So I was reading this article about supplements for healthy aging, and it got me thinking.
Oh yeah? What's the buzz about?
Well, you know how everyone asks, what supplements should I take as I get older?
Mm-hmm.
It's such a loaded question, and there's no one-size-fits-all answer.
Right, because aging isn't just about one thing, right?
Exactly. It's like trying to fix an old car by just changing the tires.
Yeah.
You've got to look at the whole engine, the whole system.
So, how do you tackle that question then?
I usually start by asking two questions. First, what are your goals regarding aging? Do you just want a longer lifespan, or do you also want to feel good in your 70s and 80s, maintain high-quality interactions?
Right. And what's the second question?
What specific aging concerns do you want to address or avoid? Maybe it's optimizing your bones and muscles, brain health, or getting restful sleep consistently.
That makes sense. So, it's about tailoring the approach to the individual.
Exactly, because we don't age in just one area. It's a holistic process.
Yeah. So speaking of muscles and bones, what supplements are we talking about there?
First and foremost, resistance training at least twice a week and adequate protein intake are key. Without these, supplements won't do much.
Right. Got it. So diet and exercise come first.
Precisely. For protein, I recommend 1.2 to 1.6 grams per kilogram of body weight per day. That's about 0.65 grams per pound. Spread it over 3 to 4 meals.
Mm-hmm. That's a lot of protein. Do people struggle with that?
Sometimes, but it's crucial for muscle maintenance. And to help with that, creatine is a great supplement. Consuming 5 to 25 grams per day has been shown to increase strength and lean body mass.
Interesting. Wait, isn't creatine just for bodybuilders?
Actually, no. It's beneficial for older adults too. It supports muscle health as we age. Plus, vitamin D supplementation has significant evidence showing improvements in muscle and bone strength.
So vitamin D plays a double role here.
Exactly. It's not just the sunshine vitamin, it's crucial for overall health.
Right. Speaking of overall health, what about brain health? Any supplements there?
Yes, vitamin D may improve brain health and cognitive performance. Magnesium and higher doses of creatine also have emerging evidence supporting brain health.
Oh, really? And B vitamins? I've heard they're important for cognition.
Absolutely. B6, B12, and B9 have been shown to help with cognition, especially before conditions like mild cognitive impairment set in.
That's good to know. What about omega-3 supplements? A lot of people take those for brain health.
The evidence there isn't as strong as many think. Some studies show benefits, others don't. Most experts suggest getting omega-3s from food, like salmon, and following a low-inflammatory diet, like the Mediterranean diet.
So food sources over pills, huh?
Exactly. It's usually better absorbed and more effective that way.
Yeah. Speaking of supplements, is there anything recommended for sleep?
Well, the American Academy of Sleep Medicine doesn't officially recommend any supplements currently. Melatonin is popular, but if used, it should be at the minimum effective dose to avoid circadian rhythm disruptions.
Makes sense.
Magnesium has some recent evidence suggesting it could help with sleep too.
Magnesium, again, it's quite the multitasker.
It really is. Helps with muscle relaxation, brain health, and sleep.
Mm-hmm. So, we've talked about lifespan versus health span before. Can you elaborate on that?
Sure, lifespan is how long we live, but health span is how many of those years we feel good and can live independently without debilitating diseases.
Ah, gotcha. So these supplements aim more to improve health span than just lifespan?
Exactly. There's no magic pill for a longer life, but supplements may improve our level of functioning and slow down chronic conditions. Healthy aging is about more than just avoiding illness. It's about enjoying life fully.
I like that perspective. It's about quality, not just quantity.
Precisely. But it's crucial to remember that supplements aren't the whole story. They can't replace a poor diet or lack of exercise.
True.
We need to make healthy lifestyle choices overall.
And what about supplement safety? Any concerns there?
Definitely. Most supplements aren't regulated by the FDA, so there's minimal oversight on their ingredients or advertised claims. Some may not contain the active ingredient or could even have harmful substances like heavy metals.
That's concerning. How can we make sure we're choosing safe supplements?
Look for supplements that are third-party tested or recommended by trusted health professionals. Avoid relying solely on advertising.
Right. You mentioned creatine earlier. Some people worry about kidney issues with that supplement. What do you think?
That's a common myth. In healthy individuals, creatine at recommended doses is safe. However, people with pre-existing kidney conditions should consult their doctor.
That makes sense. So, in all of this, it seems consultation with a healthcare professional is key.
Absolutely. Before starting any supplement regimen, it's important to consult with a healthcare provider to ensure it's appropriate for your individual health needs.
This has been really enlightening. There's so much more to healthy aging than just grabbing a bottle off the shelf.
Exactly. It's about a holistic approach: diet, exercise, sleep, mental health, and informed supplementation.
Well, I'm definitely going to reevaluate my own routine after this chat.
That's great to hear. Remember, small, consistent changes can make a big difference over time.
Absolutely. Hey, maybe next time we can dive deeper into specific diets for healthy aging.
I'd love that. There's so much to explore when it comes to nutrition and longevity.
Well, thanks for sharing all this valuable info. It's been a real eye-opener.
Anytime. Always happy to chat about health and wellness. After all, we're all in this aging journey together.
That's true. Let's make it a healthy and enjoyable ride.
Couldn't agree more.